Good afternoon. My name is Aura, and I'm here to do a head-to-toe assessment on you today. And I want to inform you prior to my examination that I will be touching you. And if you feel any pain or discomfort, could you please let me know?
Okay.
Can you tell me your name and your date of birth, sir?
John Smith, November 23rd, 1992.
I've washed my hands prior to my assessment. I'm just going to put on some antiseptic rub. Okay, Mrs. Smith. Your birth certificate is correct. Okay, today I'm going to do a head-to-toe assessment on you, and I'm going to be checking different things and asking you different questions. So could you please just let me know throughout my procedure, the exam, if anything is going on with you at this time. First of all, I'm looking at your basic skin color, taking his vitals prior to his assessment. His skin color is intact. There's no lumps. There's no bruises. His coloration is pink. His blood pressure right now is 132/70. His pulse is 75. He's afebrile. I'm taking his temperature, and his SAT is 100%. Now I'm going to start with my basic assessment procedures. I'm just going to be looking and feeling your skull. You haven't had any head injuries or anything?
No, ma'am.
Okay. So everything is symmetric. Next, I'm going to be looking at your hair. I'm going to be looking for any lesions in your scalp or any discolorations, which I don't see any at this point. And this is your hair color, okay? No problems with that. Next, I'm going to be looking at my patient's, your eye. You never had any eye problems?
No, ma'am.
Okay, do you wear glasses?
Yes, ma'am.
Okay. And you're wearing your glasses for?
Nearsighted.
Nearsighted. Okay, it's been corrected. You had a vision problem, it's been corrected. I'm going to first inspect your eyes, and I'm going to look. Your eyebrows are symmetric. Can you just follow this light for me? Okay. Can you look up? Look it up. It's clear. Okay, both eyes. No ring around the conjunctiva. Can you just pull your eyelids? There's no preorbital edema. There. There's no inflammation. Next, I'm going to ask you to cover one eye and see, can you read a sign for me? Okay. And you have contacts in, right?
Right.
All right. Okay, can you cover your right eye? And can you read that for me?
Before you leave, if you are wearing a heart monitor, please return it to the nurse's station.
Okay, can you cover your other eye?
Before you leave, if you are wearing a heart monitor, please return it to the nurse's station.
Thank you very much, okay? Vision is 20/20 with contact lenses. Next, I'm going to be expecting your, seeing if you have any pressure right here in the sinuses. Have you had a sinus infection lately?
No, ma'am.
No problems with your sinuses. I'm going to be looking at your nares. You haven't had a nosebleed?
No, ma'am.
Okay. Just looking at your nares. Just make sure. Okay. No septal deviation. Also, I'm going to ask you to close your eyes and identify this for me. Okay. Can you tell me the smell?
Ammonia.
Thank you. Okay. Next, I'm going to be looking in your mouth. I'm going to be checking your mouth for any lesions, any sores, and any discoloration to your tongue. I'm going to be checking also to see your oral mucosa, and just to make sure that you don't have any lesions on gum. Have your gums had any bleeding lately?
No, ma'am.
Okay. And I'm going to also be checking your gag reflex. No problem swallowing, any difficulty chewing? Okay. Can you open your mouth for me? Say ah. There's no problem. You have your own teeth. Lips are pink. All teeth are present. The tongue is pinkish and red. Not red, pinkish, I'm sorry. There's no problems with the tonsils or the uvula, okay? At present. Next, I'm going to be inspecting the trachea. Just to make sure that your trachea is midline, which it is. And he has to pronounce Adam Apple. So he's a true male right now going on. So there's no problem with that. And the next thing I'm gonna be doing is like checking your lymph nodes and just see, you haven't had any infections lately?
No, ma'am.
Okay. Can you smile for me? I just wanna check to make sure that your TMJ and everything. There you go. Beautiful smile. Thank you. Thank you. And the hide. Put your head down. Okay. No problems with that. Everything is symmetric. And now we're gonna move on into to inspect his lungs. Have you had any problems, any respiratory infections, any shortness of breath, or anything lately?
No, ma'am.
Okay, I'm gonna be doing three things. I'm gonna be listening to your lungs. Then nextly, I'm gonna palpate, just to make sure that you don't have anything going on there. And then nextly, I'm gonna be percussing, just like a little tap knock on your chest. Okay?
All right.
Okay. Let's see here. Deep breath. Okay. Before I complete my assessment on your lung assessment, I need to go back and just look inside your ears. I did not look to see if you hadn't had any dizziness.
No.
Okay, you hadn't had any any discharges from your ears.
No, ma'am.
Okay. Just look to see. Okay. Okay. I'm gonna do a little simple test, and I just want to make sure that you know. I'm gonna repeat a phrase, and I'm gonna say something. I want you to repeat it back for me. Can you close your eyes? I'm gonna do, and you tell me what I said.
Happy 4th of July.
Could you cover your right ear for me?
Happy 4th of July.
Okay. Can you cover your left?
Today is Wednesday.
Okay. I'm sorry, I just got a little bit off track, but I just wanted to make sure I did the hearing test and move on. Okay, nextly, I'm gonna be listening to, again, I wanna listen to his chest. Okay, he told me he hadn't had any respiratory problems. I just wanna listen to him to make sure he doesn't have any wheeze, bronchi, or any adventitious sounds. His lungs are clear laterally. While I'm also here, I'm just inspecting like his back, and I don't see any lesions in skin-wise, any lumps or any bumps. And I'm just gonna be just looking at the curvature of his spine, which his spine is correctly positioned. There's no problems with that. I'm just gonna be now just doing my quick basic percussion of his chest, and then I'm gonna palpate. Can you lie back for me? Down up for me. Okay. Just want to make sure. Okay, I'm just palpating over I did his breath sound, so now I'm just making sure that I don't hear anything over like his some vascular organs and everything. But right now his breath sounds are clear and his chest is symmetric. I'm still looking at skin wise and everything is correct. Now I'm gonna be looking at his abdomen. Okay. When the last time you had a bowel movement?
This morning.
Okay, I'm gonna ask you about the color and consistency of it. It was a form stew color, correct?
Right.
Okay.